This video is all about your back, the discs in your spine to be exact. Maybe you're suffering from a ruptured or bulging disc, something many people are afraid of. In this video, I'm going to tell you something no one else will, and believe me, it will put your mind at ease. Your spine is the centerpiece of your body, as you can see here quite clearly. Here's your sacrum, lumbar spine, thoracic spine, and cervical spine. And somehow, everything else is attached to your spine, a centerpiece that holds everything together. And, which is also important to know, it not only supports your trunk, it also contains the main transmission cord along which all the information that is crucial for your entire body travels. But beyond these two important functions, it also has to achieve the following. It has to be flexible. If that weren't the case, a rigid bone might do the job just as well and would also protect the lines running inside of it much better. And that is not possible because the spine has to be able to follow all our motions. And that's why your spine is made up of 24 different vertebral bodies. These are small bones that have to be able to move a bit, and so that works. And as cushioned, they have intervertebral discs in between them. So in between each and every vertebrae, you can find a disc. Each individual disc is a little biological miracle in and of itself because each has a nucleus filled with a gel-like substance enveloped in fibrous cartilage, which makes the entire system very resistant to pressure. This might remind you of trucks on the highway where you could see these rubber buffers moving up and down a bit. They are similar in design to an intervertebral disc. Very clever engineering indeed. Maybe that's where the engineers got the idea in the first place. Let me just spell out what kind of motions your spine can do. First, of course, there's bending forward. You want to pick up something. Then the counter motion, bending over backwards. Then, of course, lateral motions, bending from side to side, in one direction and in the other. And of course, don't forget rotating to the left or the right. These are just the main directions, and there are many variations in between. Just a quick example or two. You want to bend forward at a slanted angle. Or, even more complicated, bend backwards, also at a slightly slanted angle, but at the same time laterally, and with your body rotating. But let's just say you're under a tree, and this is exactly where the apple is. Then this is the combination of motions that is needed. The system's design is perfect for performing exactly such motions. And just like in so many other parts of your body, this interacting system of spine and vertebrae is extraordinarily sophisticated. The fact that we have to move is obvious. But while we are moving, the intervertebral discs get supplied with nutrients. How can that be? Just imagine they are placed here, in between, just like small cushions, and when you bend forward, more pressure is applied to the front of the disc, squeezing out any waste materials, while the back of the disc can expand again and soak up nutrients. The opposite happens when you move the other way. In a lateral movement, the discs relax on the side and soak up nutrients and push here to press out the waste material. Particularly interesting for nourishing your discs is a rotation motion, because here the entire disc is compressed and upon expanding, soaks up nutrients again. And this whole motion is the foundation for a healthy spine that otherwise would simply be starving. Now, let's look at the different motors that are responsible for these motions. And the motors for moving your body are always your muscles. Muscles pull. That's all they can do. And if the opposite muscles pull, they yield. Muscles can only pull. And that means the spinal erectors in your back, for example, they pull your trunk backwards, stretching it back. And if they contract here, the muscles in front have to yield, and vice versa. If the abdominal muscles and the hip erector muscles pull your trunk forward, your back muscles here and in your buttocks have to yield. Now just imagine, muscles pull here, yield there. Now you can easily appreciate that there is always some tension present, some basic tension. And that tension is sustained to keep everything from falling apart. part because there's also ligaments that keep everything firmly in place. And this basic tension is biologically or physiologically quite normal. And it is present in your body at all times, wherever you find joints. And now the flexibility of your spine is limited on account of its design. For example, when stretching backwards, you can imagine that the spinous processes on the vertebrae move closer together until they can't move anymore. Same thing when bending forward. At some point, the ligaments in here will stop this motion. When your spine moves at 100%, what do I mean by that? When the spine goes forward all the way and stretches all the way back, then you run through the full range of motions, and the vertebral discs can soak up nutrients to a maximum. And of course, your diet plays a major role for the health of your discs. Whatever we eat will at some point end up in your discs. And that's why you should take care of what you eat so your body has what it needs to build things up and do whatever it needs to do to have healthy vertebral discs, a healthy spine, and to keep them that way for many years. Wherever something is moving, things are pressing on each other, are shifting a bit, moving back and forth. Wherever there's movement, there's wear and tear, a physiological wear and tear. And that is not really a problem for your body, since it has its own repair mechanisms. Stem cells move in, repair what's been broken, and so forth. As long as this wear and tear is minor and can be repaired by your own body, your spine can last 80 years, or 100, or even 120 years and stay fully functional. To sum it up, your spine, in particular, your discs, need movement and nutrients, and that leads us to the big question. If everything works so perfectly, how can it be that we have bulging discs? How can we have a slipped disc, where the disc ruptures and this gel-like nucleus is pushed out? Just a minute ago, we were talking about the 100% motion, and that this is the range of motions our body has been designed for. How many of the possible angles of motion do we really use? Think about it for a minute. Think for yourself. Bending forward? That we do quite frequently. Bending backwards? Not so much. Bending to the side, to this side, and the other side? Actually, almost not at all, other than maybe in some sports activities. Rotating? Also not often. We rather pivot completely and not to the other side either. Let alone all the combined motions. We just don't do all these different motions often enough. And what else is it that we do all day long? We sit for many hours a day, more or less, but way too much, without moving around. Now, let's have a look at this situation, which is important for your discs. Let's say you're sitting. What happens with your muscles in the front of your body? They become shorter, because your hip flexors that run all the way up here get shorter, and only few people sit in an erect position with a good posture like this at their desk. At a certain point, you slouch forward into a kyphosis, a round back, overstretch your neck, and start typing on your keyboard. And that means your straight abdominal muscle and your hip flexor, to mention just two important muscles, become shorter. The fascia shrivel up, clog up, and the forward pull increases. There's a force pulling your body forward. And to hold up against this force, you have the spinal erectors in the back that pull you backwards. Now, imagine there's a force pulling you forward, as my hand demonstrates, and the muscles in the back counter. Here, a rubber band pulls you forward, the clogged up fascia and muscles, and here, activated muscles counter-pull to keep your body up. And where does this pull go? To your discs, of course. That increases the stress on your discs. And the more we live like this, the more this stress increases, since we don't do anything against it, and the muscles tense up more and more. You might have already had this experience. You give your partner a massage, and here in the back, you can often feel tensed up muscle cords. And why are they so tensed up? Because they are overtrained to counteract the forward pull by pulling backwards. And this is why they're in a permanent state of contraction. And as the saying goes, the fascia, the ligaments, for example, are the habits of the muscles. Meaning, what our muscles do will manifest in the fascia, will transform the fascia. When you continue to build up this stress on your discs over years or even decades, then, of course, your discs will receive less and less nutrients because the motions that normally take care of that nourishing mechanism have almost stopped. That pressing and releasing of the disc happens less, there's more and more pressure, but no release. The discs degenerate and become thinner. Let's say you have an MRI taken for whatever reason, and oh boy, it shows that your discs have thinned down, almost disappeared. But where did they go? Well, very simple. Over the years and decades, they have become worn down because the normal pressing and release mechanism stopped happening. Here, we are talking about the slow death of the discs over long periods of time, and often people don't notice this. They don't even know about this fact. It's not the starving disc that becomes thinner and thinner, but rather the stress that increases too fast. Then there is even more pressure on the core of the disc. And this pressure has the tendency to dissipate sideways. Since going up and down is stopped by bone, going outwards is the only option. So the disc extends outwards. Picture a life preserver you have inflated and someone is sitting on it. Then maybe the plastic will give out, resulting in a bulge on the side. And if you increase the pressure even more, the whole thing bursts. And now, this is important to understand, the pressure that before may have been this big has over the years mounted more and more, but the disc has not ruptured yet. Why does it rupture anyway? Most people this happened to can remember it all too well. Classic situation. You open the trunk of your car to unload a crate, you pick up the crate, and because it is kind of heavy and you want to get some momentum, so you swing it up and turn at the same time. And then you notice, oh, something happened. Some even say that they heard a popping sound. But with or without this sound, the dynamics of the motion and the speed cause the disc wall to rupture and the gel-like nucleus to come out. This is important to understand. With slow motion, such ruptures, injuries can never happen. No disc can rupture because your body would send out a warning signal beforehand. It can only happen during sudden, jerky motions. We know from engineering that during sudden motions, the peak loads spike 60-fold. And that means your disc doesn't have a chance. So that can only happen with fast motions because then, in addition to the mounting stress over the years, you also have a sudden peak load increase and then it happens. If you had moved slowly, your body would have warned you before because your body assesses stress levels. It knows exactly the stress and risk level of each of its parts and would have stopped the motion, sent a pain signal, and the rupture would not have happened. Let's sum up the most important facts. It's not your age that is responsible for ruptured or bulging discs. It's not your genes, or heavy physical labor, or sports activities, not the crate you wanted to pick up from your trunk. The reason why something like this can happen is something you, over the years and without noticing it, have done to your body, and that is now responsible for your ruptured disc. It's the shortening of your fascia and muscles and the resulting increase in pressure and stress on your disc that is way higher than physiologically intended. If you don't have a job or do sports that use your spine's entire range of motion that help you to prevent that kind of shortened muscles and an increase in pressure, there's only one solution left. You have to do our exercises, because doing these daily exercises for 15 minutes help you to prevent this ever happening to you. If you want to do an exercise for either prevention or getting rid of the pain after being diagnosed with a ruptured disc, then try out our exercises. Up here, there's the info card to pick exercises from, and if you do them regularly, and things will be looking up for you soon. Very happy if you like this video. Everyone should have this information, so please share it, pass it on. School kids should learn this so they know how to treat their bodies well for their whole life. A final note, if you're interested in more information, please subscribe to my channel, activate the bell so you get alerted to new videos, and don't miss any of them. And here's another educational video for you that is well worth watching.